By 3 months, is that head lag still there, or is it almost gone?
It should be much better by that point. They should be able to control their head. When you're lifting them up, it might lag slightly, but again, they should be able to have control of their head and be able to lift it properly.
When we say head lag, meaning if you pull the kid up with the hands, and the head should go with the body.
Exactly.
Okay, but if it stays backwards a lot, that's not a good sign.
That would indicate a problem.
And if you see the kids jittery and shaky, if you touch it and the reflexes are overreactive, that's a bad sign too. Is that true?
Well, sometimes. It depends. A lot of times babies have a lot of shaking movements. A lot of times.
We're talking a 3-month-old. We're not talking a newborn.
Yeah, even a 3-month-old. I mean, you can see, some quivering of the lip and some, especially in sleep, when awakening and when going to sleep, there are abnormal movements that babies.
But they start all the time. That would be abnormal.
Yes.
Occasionally, it wouldn't be a big deal.
Yeah, it would need to be evaluated, and of course, any abnormal movements that aren't expected from a baby, you'd have to evaluate.
When would you expect a kid to take something from one hand and transfer it to the other hand? What would that be normal?
Start transferring from 3 months. They can start doing that. 4 months, you can start seeing it. Of course, if you don't see it by 5, 6 months, you start getting concerned.
But it doesn't always mean there's a problem, but it's a little bit of a flag.
Exactly, it's something you want to look at.
And you also watch a kid moving and following people a little more extensively in other rooms. Is that true?
Sure. You'd be responding to sounds, responding to lights, the colors, to people's faces, all different things. Remembering also that when we are talking about development of babies, everything's on a bell curve, where some children will do things earlier on, some children do them later on, and they're still within, as long as they're within the range of normal, we don't worry and we don't do, extensive testing on them.
So we'll say there's an abnormality, but if we see certain things, we sort of keep it, and we have a little bit of concern, like a good father or a good grandfather, we would have a little concern certain things right there. Is that correct?
Exactly, and you don't, focus on any one single thing just on his motor or just on his social. You put everything together and you try to evaluate the entire baby as one.
When would you expect a kid to sit up with support that you would start looking for that?
So some babies can start by 4 months, 5 months. By 6 months, it should be there. But again, some children are on the back end of that bell curve and can still be within normal. But for sure, by 7, 8 months, if they're not sitting up on their own, it would definitely be a concern.
But without support, you would say, at what point would you be concerned? Without any support, they just sit up in a chair by themselves. What would you say that should be?
That if they can't do that?
Yeah.
Yeah, by 7 months, I would start evaluating the child much more intensely.
And what kid should a kid be standing and holding on? What would you look for that kid?
So again, with standing and with walking, it varies a lot. Where some children will start even by 9 and 10 months of age, they'll start pulling up and standing and cruising by holding on to things. But remember that some children don't even walk independently until 18 months of age, and that can be normal as long as it's in the setting of a completely normal development otherwise.
Okay, you have to look at the overall picture. We're just giving you a little highlight. But you would expect most kids between 12 and 15 months probably taking steps. Is that true?
Most children should be doing that.
Or cruising around a table, and maybe they're afraid to look,
sure.
or something like that.